I have recommended this option for your treatment because I think we have judiciously reviewed some of the other options to treat erectile dysfunction, and this has been the best option to achieve your quality of life and your goals for your sexual health. So during the procedure, you come to the hospital the morning of the procedure. Typically a couple of days beforehand, you would have been using a nice antimicrobial body wash prior to the procedure. When you come in, you're going to get some antibiotics in the preoperative area before we start the surgery. We're also going to be meeting again, kind of, reviewing some aspects of the surgery and the recovery period. After the surgery, you're going to go to a recovery unit. Most of my patients will stay a night in the hospital. There are some patients that can also go home the same day, but I typically like to have my guys go home without any drains. And so that'll be a shared decision making in terms of what you would go home with. And then after the surgery, I typically see my guys back about a week afterward, just to make sure you're recovering okay, you haven't encountered any issues. You're going to go home with pain medications and antibiotics. And then after I see you at your first postoperative 1 week visit, we then see each other again about 3 to 4 weeks after the surgery to activate and start cycling the device. Typical stay for this surgery is about 1 hospital night, and some patients it's the same day. So some patients may need a surgical clearance prior to the surgery, and this is just based on your medical history, so that varies. But if you're otherwise healthy, we just have a few kind of routine labs that are required for undergoing anesthesia and other things that we have to get for the procedure. You do have to arrange for transportation because you will be under general anesthesia for this procedure. You typically can't operate any machinery or do much on the day that you're getting anesthesia, so you will need someone to come with you to the hospital. And the days before your procedure, it's really important to think about a few things so that we ensure that you have the best outcome and that you're safe. For patients that are on medications like blood thinners, that is something that we typically coordinate with your primary care doctor or your cardiologist to ensure a good timeline for when you're starting and stopping these medications. Bleeding is a risk with this procedure, and we want to make sure that we minimize that bleeding risk. So that's important to follow all of your clearance instructions from your physician. Other big categories we think about are minimizing infections. As I had mentioned before, I typically have my guys use an antimicrobial wash for several days leading up to the surgery, and that helps to minimize infections that may be on your skin that can impact the outcome of your surgery. I also tell my guys to stop things like red wines or heavy alcohols about a week before surgery, because this can actually thin your blood a little bit and mildly increase your infection risk. About a week before the surgery, I also recommend using an antimicrobial mouthwash like Listerine. This also just helps to minimize any kind of oral, bacteria or infections that may come into play. You can certainly exercise, prior to the procedure, and we'll talk about kind of instructions to when you can resume that after the surgery. But you can exercise as you wish, going into the surgery. The medications that you have to stop prior to your surgery are really dictated by your clearance with your primary care doctor. The big things that we worry about are usually blood thinners, and so that's something that we coordinate with you, and we really get pretty tight direction from your doctor as to when you can start and stop it, especially depending on what the indication for you being on that medication is. So the evening before your surgery, you shouldn't have any food, typically after midnight, and this is something that we usually will call and remind you about prior to the surgery. In terms of things that you can't drink, I usually tell my guys to avoid particularly red wines and heavy alcohol about a week before surgery, just because this can increase your bleeding risk. But otherwise, it's really more of a time issue in terms of what you can safely do prior to getting general anesthesia. The day of surgery, just bring something comfortable, some sweatpants so that you have some room after the surgery, just to be a little bit relaxed. If you have someone coming with you to the hospital, you can certainly bring your favorite snack or meal to have after the surgery. But if you're staying overnight, the hospital will take care of that. But in general, I would say, pack some sweats, some comfy pants so that you're nice and relaxed after the surgery. I typically advise my guys not to shave prior to the surgery. Minimizing infections, particularly those that can come from the skin, are important. We will shave you prior to the procedure, so you don't have to worry about that. I also encourage my guys within your groin area, if you notice that you have any rashes or anything that's come up, to let me know so that we can inspect it and ensure that it's still safe for you to undergo the procedure. I recognize that surgery is nerve-wracking, and I acknowledge that. But hopefully you recognize that you are in great hands, and I'm here to really help to minimize those worries. We take a lot of care to get you into the operating room and to get you out of there safely. And certainly I want you to be happy with getting to surgery, especially with the outcome that we're working towards. So it's totally normal to be nervous about the procedure, but I think myself and my team, we work really hard to make it as comfortable as possible. You'll be given a list of quick contact numbers to call prior to the surgery. My office is very responsive in getting back to you to answer any questions. If you have access to your electronic medical record system, there is a portal there that you can send messages directly to myself and the team. And so we are readily available to answer any questions you may have leading up to the surgery.